Barreto. Ella es mi hija Daniela Jiménez. Yo estaba bien preocupada por ella, porque ella sentía ese dolor, ¿no? Y ella me decía, ¿cómo hago, mamá? Yo quiero sanarme.
It's a calling to do the work that we do. My dad was a physician, and that kind of put the seed in my heart. He used to, one day a week, give it to the poor, not able to pay. This is how I wanted to be a doctor.
Solidarity Bridge organizes what we call mission trips, but for over 2 years, we're completely unable to travel. And we're seeing the fruits of the way we had worked the previous 20 years. Our Bolivian partner surgeons know that to serve the most vulnerable populations, they need to get out of the cities, they need to take the surgical care to remote sites. And so that's how they came up with this idea of surgical campaigns, where they fill a van with the equipment and supplies they need, and then set up surgery services in municipal hospitals.
Buenos días, mi nombre es Vicente Fernando Nogales Arandia. Yo soy cirujano general y cirujano colorectal de profesión.
The Municipal Hospital of El Torno, like many rural facilities serving lower-income patients, can offer only basic surgical services. Their doctors are limited by a lack of advanced equipment. By working together with local partners, we have brought equipment, updated training, and complex surgical care directly to El Torno, giving the people of this town hope for a healthier future.
Mi nombre es Jovita Hurtado. Trabajo aquí en el Hospital Municipal del Torno. ¿Cómo está, mi amor?
Our social workers partner closely with Nurse Jovita to connect patients in El Torno with the surgical care they need. We support and accompany each patient and family to overcome their specific financial, logistical, or other challenges. Barriers increased during the pandemic, but our solidarity with and commitment to our partners and their communities has never wavered.
Claro que tuvimos muchas limitaciones y bajas, pero había pacientes que no podían esperar a que pase la pandemia para poder realizar este tipo de procedimientos.
Surgery is an essential part of healthcare, a treatment for nearly 1/3 of all disease. Our partner doctors continued operating throughout the pandemic with medical supplies collected and shipped from donors across the U.S. In October 2021, we returned to El Torno for the third time. Thanks to Dr. Nogales and his team, not only did patients in El Torno receive high-quality care, but local hospital staff also received training in minimally invasive techniques.
If patients are unable to access surgical care, it can also often snowball into loss of employment, loss of the ability to care for one's children, the ability to care for oneself. It can affect the wider family and the entire community.
Yo me llamo Florencia Quispe Castro, tengo 49 años y este es mi hogar, mi casa. Estaba ahí tiempito ya de mal de vesícula y hace 2 meses siempre me agarró el dolor y ya no aguantaba ese dolores.
Intense pain disrupted Florencia's life for months. Since her surgery, she again is able to be the primary caregiver for her school-aged daughters.
A surgery such as a gallbladder surgery is inaccessible, it's unavailable. And if a patient were to travel to seek it out elsewhere, it would require spending about 1/4 of their annual income. We're able to lower the cost of surgery to half or 1/3 of the cost of what patients would otherwise have to pay.
Teodoro is another patient from El Torno. The pandemic has been immensely challenging for him. His wife died of COVID, and in the midst of his grief, he also suffered debilitating symptoms from gallstones. Without his wife, he had no one at home to help him through periods of intense pain.
Tampoco estaba mi hija, estaba en la ciudad mi hija y yo estaba solito. Al verme que estoy mal, no podía soportar el dolor, he tenido que irme al hospital. Pero no sabía cómo soportarlo. Y ahí ya era que me encontraron, que me comentaron que había esa campaña.
Muchísimas gracias por haber llegado con esa ayuda, por ayudarnos a ella y a mí. Muchísimas gracias.
To date, Solidarity Bridge surgical programs have provided over 7,000 surgeries. But we know, in fact, that there are many thousands more who have been served and who continue to be served every day thanks to the training, the skills, the equipment, the supplies that we've distributed throughout the country.
Me gustaría agradecer a todas las personas que hacen posible de que esto suceda. Es muy importante que a través de todas sus donaciones, realizándola para que varias personas puedan obtener lo mejor en lo que es salud.
Every one of those 7,000 and many thousand more, it's not just that patient we've served. It's that patient's family, it's that patient's community.
Together with mission-hearted providers, the staff of Puente de Solidaridad and Solidarity Bridge, and our generous donors, we are building a healthier future so that patients like Daniela, Florencia, Teodoro, and so many more can continue to shine forth into the world. Thank you for responding to the call. Thank you for joining us in this mission.